Good evening, everyone. This is Aaliyah Sherrod, the health care queen, with Carmen Bernard, boss lady. We are the Millionaire Ladies Mob. Saran is missing tonight. She is traveling. So if she pops in, that's great. But we are going to have a part two of the deeper dive that we had last week into health insurance. And why
Oh, yeah.
do we need that? It's because today I was involved in a meeting with one of the exchanges, and it was covered California. I used to live in California, so that was my main state. In Carmen, what I found out, it alarmed me. So as much as I can, if I have to do this every day, every week, we need to talk about this. Is because our community, we as a community are not doing what we're supposed to do. And California has the statistics to show that. And I
Hmm.
was shocked, Carmen. I was
Wow.
absolutely shocked. So we'll recap what we went over, and then I want to go into a little bit of those statistics. So last week we talked about why you need health insurance and what health insurance is, that you could possibly get subsidies. And it's a protector. This is what, Financial Literacy Month? Is that what it is, Carmen?
Correct.
It is part
Correct.
of your financial literacy. You have to know what you have. You have to have health insurance as part of your package for yourself and your children. It's very important. When I think about all the years that I had health insurance that was provided by an employer, I think back, and we took it for granted. That health insurance to us and provided for us was our right. Well, the
Right.
employer pays a part of that. People don't understand that. The employer pays the bulk of the cost for the health insurance. And people think, oh, the employer's rich, they have money, they can provide. But it's getting harder and harder for an employer to provide insurance for their employees.
Yes.
So, what else did we talk about? Deductibles. We went over what a deductible is, what a copay is. We talked about what the out of pocket maximum is. When you look at your policies, and most of you don't even understand it, and there are a lot of you that do, you know that there's a number. What does that mean? What does that out of pocket mean? Those are some of the things that we talked about. Did you want to add anything, Carmen, to that?
Yeah. Those were some good points that we covered. We also talked a little bit about the differences between a copay and the deductible and co-insurance. Those are three separate things. And if you missed it, you want to go onto our YouTube channel, because that live is saved on our YouTube channel, the Millionaire Ladies Mob. Just search Millionaire Ladies Mob and you will find that. Um, we I'm not sure if we kind of let you understand that you can get, for those of you who qualify, can get premiums that are or plans that are zero premiums. But is that the end all, the be all end all? Is that plan going to work for you if you became sick and you had to go to the doctor? Many of those plans, the preventative things are covered, but when you actually need it and you become sick, you might end up having to come out of pocket and you may not understand why. So that's why we were talking about the differences between deductibles, co-pays, and co-insurance. So we got into a little bit about that. And I tell you tonight, if you are watching and you have a question, we don't care what it is, please go ahead and type that question for us and we will respond. Even if we have to respond, that we need to look it up because health insurance is complicated. Obamacare, Medicare, Medicaid, understanding the differences, understanding who qualifies, understanding what you qualify for, it's complicated. Aaliyah and I have to take a course every single year to be certified to do what we do. And we also have to be certified by each and every carrier that we represent. We have to take a course, we have to pass the course in order to be able to service you. Now, if that is the case, do you think that you can benefit from our expertise in the field? Because if we have to take courses and you don't, but you're expected to find the best, and even though we don't like to say the best when it comes to clarifying the companies, I'm talking about the best one for your situation. How are you able to do that without the knowledge? Sometimes the plans, there's so many of them and it's so much information. You just decide, you know what, I'm just going to just pick one, just close my eyes and point, and that's the one I'm going to go with. And that you can be giving up thousands of dollars. And once again, I want you to make understand that health insurance costs is the number one reason why many people, when many Americans go into bankruptcy. Health insurance costs. And um it's not because they don't have health insurance. People may have health insurance and they still end up going into bankruptcy because they are still cannot afford what they have to pay. And some of them did not prepare. They didn't realize. And who prepares for paying $30,000 a month for a medication? Who does that?
Yeah.
Who prepares for paying that? And
Mm.
even many of us who say, you know what, I don't need it because I have money. I have $1 million saved. Do you know how fast that will go if you're paying $30,000 a month for medication, one medication, and you still have other things to do? Why don't you share that story, Aaliyah? I know you don't want to be gloom and doom, but
I
I know you
know.
spoke to someone last week whose medication was $30,000 a month and they
Yeah.
could not afford to get that insurance. Let's
Right,
talk a little
right,
bit about that.
right. So, what we do is we do a couple of things. So we do the individual side, which is under 65. That's a market in itself. Then we do the people who are turning 65 and going on Medicare. Or if you, there are a couple of ways you can get on Medicare. It doesn't have to just be because you turned 65. And so I was referred to a gentleman, and the whole day, it just messed up my whole day. And because we are passionate about what we do, because people don't see the ramifications of not having health insurance, and we all take it for granted that it's oh, it's okay, I can go without health insurance for 6 months, I'm healthy. So this gentleman was diagnosed with cancer in probably late 2021. He worked at an employer, had great health insurance. Well, now he couldn't work because he had to have all this treatment. Okay, so he was out of work for almost 2 years. In his company, some of us have companies that will pay for our medical cost, our health insurance cost while we recuperate. There's FMLA, there's disability, there's all kind of things that an employer, especially when you've been with an employer for a period of time, they might do those things for you, but they have other alternatives. There's Cobra, there's all kinds of things to keep your health insurance. So this gentleman was able to keep his health insurance because his employer paid for it. He never went on Cobra because the employer paid for it, and then he would reimburse them some portion. It's kind of complicated. So he turned, well, he was already 65, okay? But he got on Medicare. This is before I talked to him. He got on Medicare January the 1st, which was the Part B, okay? And I know I'm getting a little ahead of myself, and we'll go over the
We'll come
particulars
back
about
to that.
Medicare in
We'll come
another.
back to some of those
Yeah,
terms
we'll
that
come back to that. So he did the parts that he was supposed to have, but his employer still kept him on the plan, which shouldn't have happened, but it did. So in March, the end of March, his employer took him off the plan because he's been on the plan almost 2 years or more than 2 years. It's time to either go on Cobra or well, it's time to go on Cobra. You're not actively working because you're too sick. He missed a couple months of his treatment because he was in limbo and didn't know he still had employer coverage. He thought they had canceled it, and he had Medicare. He didn't have anything additional. He didn't have it. The doctor, when he finally got to the doctor, another insurance agent put him on a plan that has a limited network. He has a doctor that he needs to go to that's not in the network. He has tests, he has chemotherapy that he has to take that he hasn't taken in several weeks that's life-saving for him. So because of that, they had to put him on a medication. This medication, Carmen, I just wanted to cry. The medication, I looked it up, is $30,000 a month. This is to treat his cancer, life-saving treatment for him. So there are a couple things that I could do, and there's a couple things that just were out of my control. Number one, a lot of times the doctors and the hospitals and the nurses and these treatment centers are not in network. Luckily, this one was. The doctor was able to prescribe this medication, and they were able to get him in some type of a program, okay, where he's going to be able to get this medication. But the stress of all this, he's so weak. When I talk, his voice, everything is just super weak. And I just wanted to cry. That whole day, I was good for nothing because of the emotional toll that it took on me to try to help him to get what he needed. And these are the things that I go through on a daily basis talking to clients. This is why I'm passionate about what I do. And $30,000 for one medication, we don't think about that. So we think, okay, we're going to be healthy forever. He didn't think about that a year ago. He's like, I'm doing my treatment, I'm going to be okay. But as he progressed, it's getting worse. And the truth of the matter is now that he's on his medication, it's really just, let's see if this works, because the chemotherapy wasn't working. And it's just, it's so sad. These people, these are real life stories that I go through every day. I would have put him on a plan where he could go to any doctor, any hospital in the country that he wanted to go to for treatment, and the plan that he has. And this is why it's so important to talk with an agent, even if you're on the exchange or getting insurance on an individual basis. Networks are very important, and prescriptions are very important. I do ads for people to reach out to me to get insurance. As I'm detailing the plans and looking at the fine print, and that's what I do. I love to look at the fine print. I see that, okay, yeah, this policy or this plan doesn't cost you anything. Great. And wow, you've got a great network, but guess what? Your deductible is almost $8,000. And if you, but you do have a copay for your doctor, but guess what? If you go take some lab work, you got a 40-50% coinsurance. These are all the terminologies that we talk about. When you go take lab work, you've got this coinsurance that's like crazy. So I went and took some lab work, but my doctor, the bill was over $400 just for the lab work alone. And it was just a couple of blood tests. They were checking for something. So you don't know how much that lab work is going to cost. It could be $1,000. It could be $400. It could be $200. Your portion, 20 or 30 or 40% of that, after the insurance says, hey, we're going to whittle this down to $200 or whatever. There's so many little things that happen in health insurance. And that's why we're detailed when we talk about things like this. The gentleman that I talked about, he seems to be doing okay, but his spirit that day was broken. Yeah. And I had talked to him the week earlier. It was broke. I mean, it was totally different than when I talked to him earlier in the week. So yeah. That's what happened. That's what happened.
Wow. Thank you for sharing that story. And we're going to kind of use that person as our example when we try to reach back and explain certain things. So one thing that you said, there's a lot of things we got to come back to, but one of the things that you said was, yeah, you may have a good premium or something like that, but when you need to take lab work, you have to come out of pocket. And sometimes the wording is what you have to think, because it may say something like this: it is 50% after the deductible,
Oh,
which
yes.
means if you have a $7,000 deductible, it's 100% to you. Whatever it's called, whatever it is, right now, you're going to pay all of it. So if it's $500, if it's $250, if it's an MRI, then those things can be $675, $1,000. That's for you to pay until after that $7,000 is met. Then the insurance company will now pay 50% of whatever it is that you had to pay. And that is important. And that's the reason why you need someone looking at those things, right?
Mhm.
Um, and then you said another thing, which was limited network. And that's absolutely important when you need to see someone, right? And we're going to talk about what opens that network for you, some of the things that can open that network for you. So, another thing she mentioned was Cobra, okay? And some people who have worked at a job and maybe left a job, or um, uh, resigned, or was terminated, or something like that, may be familiar with the term Cobra. But others may be like, "What is that? I've never heard of that." Right? And you know what else makes me sad? Right? The fact that we are on here week after week, month after month, and people click on it and they're like, "Oh, they're talking about that boring old health insurance or life insurance," and they click right back off, right? And however, let it be. What's the newest thing taking over the internet right now? The Drake dishes, Quavo. I never even heard of a Quavo. I didn't even know there's a Quavo. I know about Drake, and there's some kind of dish going on, and it's millions of comments on these things. So if we were to come on here and talk about Drake and Quavo and P Diddy and who did it. And by the way, if you ever see me on here discussing about Drake and Quavo or whatever, somebody did something to me. So come find out about me, because something is absolutely wrong. And it's the same people that will then have a problem later, and then they're trying to come find you or something after it's now really late to solve the problem. But I digress. I digress. Um, and we will be back week after week, because we feel that it is our responsibility for helping our community and do this. So we will come back and do this.
And you know
But
what, Carmen? Remember, I said there is a state, and I was on a call today, and I'm just looking at this, and what they did, or what they're doing, is they have statistics of enrollment for certain nationalities. Okay,
wow,
our nationality, our culture, they spend their ad budget based on this. So African American community gets 1.4% of the ad budget.
wow,
1.4%. And the reason why is because of the variation in the non utilization of services. So even if we get insurance, we're not going to use it. Okay. So that's why we get on here every day. And a lot of times they're not worried, because you're not going to use it and then you're not going to get it. So we have the other nationalities that get 40% of the ad budget. So we want them to know you can get subsidies, and you can get your insurance at zero cost. You can get most of your deductible paid. You can get most of your copays paid. And that is because we as a people need to pay attention. Go get your mammograms. Go get your pap smears. Go get your annual wellness exams. The incidences of cancer are rising in young people. It's the food we eat. It's the air we breathe. Here in Arizona, I get an alert about air quality. Okay, I don't know if anybody ever does that, but air quality, what happens when the quality of air is bad, Carmen? It gets into your lungs. It
Listen to
causes
your
all
lungs.
kinds of issues. So
Yeah,
these are the things that are, these statistics are being taken and we are not paying attention. That's why I'm bringing it to your attention. You can get a subsidy. You're self-employed, you quit that job and you are trying to make your business work and your income has gone down. You can get that subsidy. I can help you. You can get insurance for your family, great insurance for your family in whatever state that you live in. I am licensed in most states. I'm not licensed in Alaska. So, or Puerto Rico, I'm not in there. But,
I'm like
but
shocked.
the other states, I am. I would get licensed in Puerto Rico, but the license is so expensive.
Wow.
It's like
Yeah. Matter of fact,
$1,400.
I got a couple of licenses that's coming up. That it's my birthday. My birthday's next month, and I keep getting these things. Hey, you need to renew. We're doing this as a courtesy to you. Renew these licenses.
And that's what we
And
do. We
and it's
get licensed. We want to
licensed.
help.
We get licensed, and we have to pay for those license. We have
Yes,
to take
yes.
the exams to say that we are we're able to even get the license, because if we do not do the education, if we do not do the courses that we're supposed to do and pass them, we cannot get the license. It's not like you do the courses and then they give you the license. You do the courses, you pass it, and then you go pay for the license in order to help you, is what we do. And what's important is that most of the things that we do, there is no payment to from you to us.
Right.
When we do life insurance, I mean, if we're doing coaching or something else, or we're doing consulting on something else, then maybe. But most everything, there's no cost to you. And that you talk about our community, and that they realize the underutilization. So they're like, why should we spend our dollars here? Let's go spend our dollars here because these people use it. That happens across the board, right? The reason why more people have life insurance and things like that is because they're presented with those things. We are presented with something else, right? Because we have been bamboozled into thinking that we are insured when we have a couple of $1,000 for final expense and things like that. And we group that as one thing. Oh, I have insurance, and we walk away. We just told you that's $30,000 a month for medication. What is $10,000 in life insurance? What is $50,000 in life insurance? What is even $100,000 in life insurance? It's better than nothing, but it really isn't anything when it comes to passing wealth to your family, especially if you are someone that people depend upon, you know. And the thing about it, where you talked about the utilization as well, I see in other communities that, and some of these things you do it's there's no income requirements. These people are just doing this because you meet it from some other criteria, and they use the resources. Like I was in school, I was in the school system. You would see other communities using the resources that are provided to them free of cost, regardless of how much millions they make or thousands they make or whatever. Whereas us, we do not take advantage of those things,
And you
right?
know what, Carmen? I didn't even know. I got a notice. There was a fund for people that had homes and they were having trouble making their mortgage payment. That fund, we didn't know anything about this fund, but guess what? Other nationalities knew about it. It's all
Oh yeah,
gone. We
yeah.
can't access it now. I was looking at it, so I went on the website, and I'm like, isn't this interesting? Who knew about this? There
That's
are
the
funds for
thing.
that.
Well, we know we're not surprised. We shouldn't be surprised when they made so many changes to the healthcare so that so many more people would qualify for it.
Yes.
They didn't advertise that a whole lot. No one knew that we had this ongoing rolling open enrollment for 24 months or more, that you
Mm-hmm.
could get health insurance at any time. It did not matter. And now those windows have closed, except for some other exceptions.
Hmm.
But
The poverty
when
level is still going on till I
poverty
think it's
level,
November of this year. And what that means is that if you make a certain amount under the poverty level, you can still get health insurance. Please don't miss out on the opportunities. People are losing their jobs. Arizona, every day I get a ding about an article where people are losing their jobs. So that
yeah,
means they're losing their health insurance too. And we
yeah,
have to be don't think that you can't qualify. Don't think that you have to take the cobra unless you're in some kind of real serious treatment and a special situation. Insurance is something that you can get. Health insurance.
yes, definitely. And like we said, Cobra is something that the employer would provide to you. Where now, instead of the employer making a majority of that payments toward the premiums and stuff, now you have to make all of it
That's right. And you know what people say,
yourself.
Cobra's expensive. Cobra's expensive. It's not Cobra is expensive. This
This
is
is
what the premium has been. You
good.
just didn't know it.
Right, because the employer was
Right.
covering some of it,
Right.
and of course the employee, like Aaliyah mentioned earlier, it's not an entitlement, it's not a right for them to provide insurance. There's some laws on the book that says they need, depending on how large that employer is, that and how many hours you're working and things like that, that they have to provide insurance to you, but not to your family. So if you might have insurance that they are subsidizing or doing a part of it, but now you have to pay all of it for your rest of your family, and whether your husband, your spouse, or your children, and that's where that insurance may become what is considered unaffordable for you, and
Right.
that's where you don't have to um, figure out whether I'm going to eat or whether I'm going to pay for my insurance. You speak with a licensed professional like Aaliyah and I, and we can see if you are able to qualify for some of these subsidies that are out there for you to take advantage of.
And you remember when the young lady Carmen had a show yesterday with a young lady who has a home healthcare business, and I was shocked when she started talking about some of the incomes that a lot of the seniors are living on. When she said $800 a month, $1,000 a month, there are a lot of people who are living on that as a senior, and I mean, there's no way they can't go out and get a job, they can't drive Uber to add to that, and that's what they've got to sustain their the food. If they need clothing, I'm getting to be a minimalist because I'm getting rid of all this stuff I don't wear, but that's me. Because as the older I get, I'm like, why do I need 50, 60 pair of shoes? Why do I need that? So we have to
Right.
think about a lot of things. As you grow older, things happen to your body. You need to keep health insurance. So that young lady, when she talked about that, and there were some other things, we're going to have some more series on home care and home health care and making sure that you're protected for that. Health insurance is a part of that. Financial literacy month, this month, you have to have your ducks in a row. You have to have everything that you need taken care of before life happens,
Yeah.
before you have that accident, before I can go out here in my backyard, step off of my patio and fall and break my ankle. I mean, it happens every day. What am I going to do? I'm going to go to
Yeah.
the emergency room. I have the ambulance take me to the emergency room, and they're going to fix my ankle. But then I'm going to come home. Guess what? I need somebody to help me because you're not supposed to put any weight on that ankle, and that is a
Right.
real life incident that happens on a daily basis. So we got to think about all that stuff. I digressed. Okay, go back to what we were talking about.
Right, that's absolutely true. So, we talked a lot about under 65 last week. We focus a lot on under 65, and I am 100% sure. that there are things that we haven't covered. So if you come up with a question, please feel free to inbox us, comment below the live, and or share this live so someone else can ask questions. But right now, I just want to talk a little bit about Medicare, Medicare, CARE. And Medicare is typically for people that are 65 and older, or people that have been deemed disabled according to Social Security for 2 or more years, after 24 months, and are people that have, there's two things that get them instantly on, and that is the kidney,
End stage renal,
end stage renal disease, which is
or
kidney
ALS.
failure, and you're on dialysis, and ALS. Those
Yes.
things will get you on there right away. So
Mhm.
you could be 25, you could be 40, you could be 60 and on Medicare. But Medicare, even if you retired and even if you're getting Social Security at age 62, if you are not in one of those other groups, you cannot get Medicare until you are age 65. And you know
Mhm.
who this affects mostly? Women.
Yep.
This affects mostly women because we tend to stop working 60, 62, 63 or something, especially because we're being covered under our spouse's insurance. And when that spouse turns 65, if that spouse has to, sometimes they don't have to all the time. We'll talk about that. But if they have to go to Medicare, Medicare is just for you and you only.
Yep.
The
It's not a group
wife,
plan.
not a group plan. You can't. You can be on the same plan as your spouse, but that doesn't mean that you are. You can be with the same insurance company, but that doesn't mean that you're together. You could even have the same plan with the same insurance company, but it's an individual plan. And so a lot of us have to figure out how we're going to be insured up until we get to 65, right? And depending on our situation, we may or may not qualify for Obamacare, the Affordable Care Act insurance, and we may have to pay, we'll get the insurance, but we may have to pay the full price for it because we're not getting a subsidy.
Now,
But
Carmen, this is the, I got a message, a notice from somebody that we have to take this course called AHIP. And
yes,
so everybody has to take, if you're going to be in the Medicare space, you got to take this course. When I got the email, I got sick because it literally takes me at least 2 months because I'm licensed in all the states and I have all the carriers. I have to go take the AHIP first.
right.
The main courses trickle to all the carriers, all the states, and then I have to go to each carrier and take all their courses and all pass. I have to pass all this stuff. It literally takes me between 2 and 3 months to finish all of my requirements while I'm trying to work and help other people. This is a part of the year I dread. So it's like I take the holidays off and things like that. But when I take it off, I'm here trying to fix and get my AHIP done and get my it's like I'm like, oh my goodness, it's Medicare season almost again.
And that comes in about 2 months. We start in
Yes,
literally in June preparing
yes,
for the next year. So for 2025, we're starting in June. Meanwhile, we still servicing people in 2024, but
yep,
we're starting literally in June. That is so so true, right? And
yes.
my husband has asked me why. Why are you doing this? Why do you do this? And he says, I would not do it. you know.
Oh,
Um,
really?
yep, that's what he tells me. I would not do it. I don't even understand why. Why are you doing this? But you know what? I simply love it.
Yeah.
I love the helping of people. I love making that mud clear because that's what it should be called. Medicare. It should be called Muddy Care. That's what it should be called. Muddy Care. But I'm going trademark that. Don't steal that. But that's what it is. It is as clear as mud. You know, But we're going to make some things clear for you tonight, just a few things. So if you turn in age 65 and you are somebody that must be enrolled in Medicare, and that's another thing we always have people are saying, well, I'm already on Obamacare. I'm paying $20 a month. I'm just going to stay there. No, you cannot do that. Okay. So if you're turning 65, there's a time period that you have to enroll in Medicare. Okay. And if you do not do it during that time period, you may be subject or you will be subject to penalties. Okay. And the penalties, y'all, it's not a one time penalty, it's a lifetime penalty. So if you were subject to a penalty of $20 a month, it's going to be $20 a month for the rest of your life. So that's
Yep.
the reason why it's absolutely important to understand that enrollment period. It's a 7-month period. All right. If you're listening, if you have aunties, you have moms, you have grandmothers, if you have, you're 30, your mom could be close to that age, or she might be 50, or if you're 50, you might have a 65-year-old, 70-year-old mom or something like that. Understand this time period. It's 3 months before your birthday, the month of your birthday, and 3 months after your birthday. And as long as you enroll during into Part B, Part A and Part B, in that time, you will not face any penalties. However, but I told you this was muddy clear. It's clear as mud. Everyone doesn't have to enroll, because if you are, and I'm loving the caveat here, right? If you are working full time and you have employer coverage, then you may not have to enroll if that employer has 25 or more
There's so
employees.
many rules.
Right. And they provide coverage. So if they have 25 or more and they provide coverage, some employers decide that when you turn 65, you need to go on Medicare because Medicare becomes primary. So they may say it's time for you to go, and you have to go, and you have to do it within that 7-month period that I explained before. But there's some people who continue to work during who continue to have employer coverage, and when they are ready to retire, or when they lose their jobs or whatever, now they have what is called a special enrollment period, an SEP, to enroll. So that first period that I talked about, that 7-month period, that is called your initial enrollment period, initial coverage enrollment period, right? ICEP or IEP. For one
There's
of
so many acronyms.
it's
And
yeah, it's IEP for your Medicare Part B, and ICEP for your Part D, which is a whole another thing. So I talked about who is eligible for coverage. Why don't you talk about what's Part A and what's Part B and what's Part D?
okay, so part A, and this is where a lot of our senior community gets really confused. So I do a presentation and I go through the ABCs of Medicare from start to finish. I don't deviate from that, because if I do, and I don't tell you something that the government says you should know, and then I'm supposed to tell you, I could get in trouble for that. So that's why you talk to me, you're going to be on the phone with me for 30 minutes minimum. I have to tell
Minimum.
you what Part A is. I have to tell you why you need Part A. If you get Part A for free, some people do, some people don't.
Right.
Part A, you go to the hospital. That's what Part A is. A lot of people, and I've come across these people that said, I don't need Part B as in boy. Part B as in boy is your office visits, your anything outside of the hospital. Your CAT scans, your MRIs, your lab work, your blood work, your urgent care. Those are the things that are covered under Part B, and there is a monthly cost unless you qualify for Medicaid or some kind of form of assistance. I'm not going to say that there might not be a monthly cost, but it is a monthly cost. And this year it's $174.70, I think. So we have to explain the details to all of our clients. And this is required of us by the Center for Medicaid and Medicare Services. We have to tell you this information. Now, when you call Aunt Bob or Aunt Susie or Uncle Bob and you tell them, hey, I'm going to get Medicare, they say, oh, you don't need Part B. That costs too much money. Don't listen to them. They are not a licensed insurance agent. You need professional help when you're dealing with Medicare. It is regulated for me. It is highly regulated. Okay. I can't go over plans with you. You have to sign a form that allows me to talk to you. This is the government. So these are things that we do on a daily basis that you guys probably have no clue about. But why do I do this? Because every senior I talk to tells me it is so confusing that they don't even know why they have to go through this. They have never made a real health insurance decision in their life because guess what? Their spouse either did it because they were insured by their employer, or they were employed in their employer. The HR people said, hey, these are the plans we have this year, pick the high, low, or whatever. Now you've got to decide, I want Medicare Part A. Medicare Part A, again, is the hospitalization. There is a deductible. Then after so many days, there are copays per day. Part B, there is a deductible. Then it turns into a regular 80/20 plan, but you pay for Part B every month, not one time. And I can't believe how many seniors say, okay, that's one time, right? No, it's every month. Why do I have to pay for Medicare when all my working life, there's a section on my paycheck that says Medicare? Why do I have to still pay for it? These are the things that we have to answer, and we have to talk to our clients about this. And I have to get them off of the ledge because they thought everything was free.
Everything was going to be free.
Everything is not free. You have to pay. And every year, I'm going to tell you this, every year, these numbers change every year. So this year, I just remembered what the first 60 days of a hospital deductible is for 2024. Guess what? For 2025, it's going to change. So these are the things that we talk to you guys about. And when you call us, we're not just going to just say, okay, I want you to go on this plan. You might call somebody out of the blue, or you might go online. Please stop going online and putting your information in unless you know that somebody's going to call you and that person is a licensed insurance agent in your state. Let's go back to under 65. Stop clicking on the Facebook ads that promise you $6,400 a cash benefit. Stop it. Because guess what? These people are changing your health insurance 4 or 5 times in 2 or 3 months. You are having to go to different carriers. Your deductible is changing. Your prescriptions, you may not be able to get your medications. I am living this with clients that I have because people are getting changed time and time again because they want $6,400. I get it. We all need money, but think about it. Is that really feasible? Just because you went into a medical insurance plan, they're not going to give you the money. Money's going to the carrier. So I digress back to under 65. Even in the Medicare space, Joe Namath, what was his name? Dynamite. What was his name? I can't think of his name. There were commercials. Jimmy Walker. There were commercials. And so every time I talked with a client, they would say, I want all those things that they talked about on the television. That might not pertain to you in your zip code. These are the things that we have to overcome when we talk. And I have compassion because I understand your people are living on a low income. Some people, not everybody, but some people are living on their Social Security. You have to think about when you are ready for Medicare. There are things that you have to think about. You cannot not do anything. Okay, you have to do something because Medicare has time periods. You don't have to take it, but if you don't take it, there's a penalty. That's what I tell them. You don't have to do this. This is not required, but if you don't, when you decide you need it, because a lot of people do that. They decide, okay, now I need it. 6 years later, I want Part B. I never went to the doctor in 6 years. Why not? You don't know what's going on in
Right.
your body. Most people need an annual physical every year. Colon cancer is taking out our men, our women. It is taking us out in droves. Why? Because they never got tested for colon cancer. They never took a bowel test. There's simple things you can do sometimes. So when we talk about insurance, they're life saving. I know the 3 months, everybody that I talk to, somebody has just been diagnosed with cancer. And this is why we do this. This is why we come in and we talk about this all the time, because we want to bring it to everyone's attention that this is something that we need to worry about. We need to take the bull by the horns and think about, okay, what is going to happen to me? The food that I'm drinking is contaminated. I'm sorry, the food that I'm eating could have contaminants in it. The water that I'm drinking has all kind of particles, all kind of stuff. Our walls, there was a time in the 50s, 60s, and 70s. What was it? Asbestos. We didn't know it was going to hurt us. So now that you can't use asbestos in building materials. But what about the people who lived in houses that had asbestos? There's so many things as far as our just our environment, the grass. What do the cows eat? What do the pigs eat? Just think about all the things. We don't grow our own food anymore. We go to the grocery store. There's the pesticides. What is it doing to our body? My goal is to make sure everybody just has a physical every year. There are young people, all the celebrities that are just dying. One young lady, she knew something was wrong with her, but she went to the doctor and it was too late. She had some form of cancer, uterine cancer or something like that, and she died. She was so beautiful, had the beautiful family, young babies, and she passed away. We have to take control of our health. There are what I want to garden because I want to grow my own greens. I want to grow my own parsley. I want to grow my own tomatoes. I want to grow my own stuff. But it's hot out here in Arizona, and I don't think it's going to work. But why do I want to
You
do
might
that?
have to do some of those things where they put the little domes over it or whatever.
I know. But these are the reasons that we need insurance, because I want to go every year and take my blood test to see if, as African Americans, we are prone to diabetes. Our men, diabetes, you guys, you don't eat right, you don't exercise. A lot of us, I'm included. So we get pre-diabetes. What is pre-diabetes? That's not to me, it's not a real diagnosis. It's just telling you you need to stop before you get diabetes. That's what it's telling you. But you don't know that unless you go to the doctor and you take the test and you see a doctor and you do your annual wellness. These are things we encourage, and insurance companies encourage it because guess what? Obamacare required that all insurance policies under the Obamacare, the health insurance, covers them at no cost to you. Now, you go to the doctor and he starts saying, okay, let's do this, and it's not a preventive test. This is how we get caught up, and now we got more to pay for. And I'm a victim of that because I do the same thing. The doctor tell me take this test, and that test. Now it's not preventive. I'm going to take it because he recommended it. And then the insurance company can say, you know what? I'm sorry, you don't have the symptoms for this. I don't care if your doctor wants you to take this test. And it recently happened to me. And so guess what? I had to make a decision. Do I keep trying? Do I appeal it? Or do I pay for the test out of my pocket? Well, I got a chance to appeal it and I'm going to get the test done. So little things like that, you have to take charge of your own health. And it's because the air quality here in Arizona, when I get those alerts, I don't go outside a lot, but when I do, I don't want to have to worry about the little particles going into my lungs and damaging my lungs. And if it does, I want to know about it in advance. Okay.
Exactly.
So I know I said a lot. I know I said a lot, but we were talking about Medicare A and B. That's what she asked me, and I apologize. Medicare A is hospitalization. You have a deductible, and then it goes into increments of 90 days, or and then another 90 days or something. But when I'm doing the presentation, I give you the correct information. Part B, again, is your office visits, your specialist visits, your tests that you take outside of the hospital. Part B costs money. Okay. It costs money every month. And then once you reach a deductible, and this changes every year, you go into an 80/20 plan where you pay 20%. The company that your insurance pays 80%. And that's part A and part B. We haven't even touched the surface of part D, which is a prescription drug plan. There's
Right.
so many facets of Medicare that we need you to reach out to us.
Yeah.
We've been here almost an hour.
Almost an hour. So here's the thing, though. I want you to one takeaway that I want you to leave with the Medicare Part A and Part B. Um, when it is an 80/20 plan, so it works kind of like your workplace insurance. You know, you have co-payments, co-insurance, and things like that. What I want you to understand, though, is that 20% that you have to pay has no limit. It's into infinity. So I mean, if you'd gone to the doctor and you had $100 bill, $20, it's your responsibility, and that's not that bad. But just think again of if you had $100,000 bill. Now 20,000 is on you, right? twenty
Carmen,
dollars
let
and
me, I have
20,000.
a, that's right. I have another experience with a client that was referred to me. So they decided they did not want to pay for anything extra. They just wanted Medicare A and B. That's it. They didn't even have a prescription drug plan because they didn't get sick. Okay. On January 1st of 2024, the husband was sent emergency by ambulance to the hospital, had surgery, life changed. Their bill is over $100,000. The 20% for any of the outpatient stuff, the hospital, all of that stuff, they have to pay all this stuff. 20%.
Oh,
The chemotherapy, 20% is what they have to pay. Chemotherapy can be, each chemotherapy treatment can be $20 or $30,000 per treatment. It's a
yeah,
lot. I don't know why,
yeah.
but it's a lot. You pay 20% of that forever if you have just straight Medicare A and B. That
That's
it was
correct.
heartbreaking. Heartbreaking.
That's correct. There is no limit, right? And there are lots of people that go through treatments that the cost is $100,000, and that means you are left with a $200,000 bill, and that is up to you. And so that is why there are options for you to cover that 20% that you have to pay. Additionally, when you get Part A and Part B, yes, you have to pay for Part B. Yes, yes, you have a deductible to meet Part B. And yes, it's a 20/80/20 plan where 20% is your responsibility up to infinity. But guess what? It does not pay for drugs. It does not pay for vision. It does not pay for hearing. There's lots of things that it doesn't pay for. But what it says, especially for drugs, you have to get a Part D plan to go with that Part A and B, that red, white, and blue card. You got to get a Part D plan, which is drugs. And most people, especially that didn't take any medication before, tend to say, well, I don't take any medication, so why should I pay for it? The reason why you should pay for it, and what you need to do in this case, since you don't take any medication, is find the cheapest, the absolute cheapest drug plan and pay for it. It may be $10 a month, it may be $12 a month, but you get it and pay for it, because if you don't do that, you're now subject to a penalty outside of the other penalties I was talking
Yeah.
about.
You guys are
Uh,
penalty up.
for life, for life.
Yeah.
Okay. And when you need it, when you absolutely need it, because you have to take some sort of medication. You might not have gotten sick. You might have just gotten critically injured. You fell from the ladder and broke something, and now you need some of those drugs that you need your ID to get it. Because it's so strong and so whatever illegal or whatever it is, legal but not illegal. Whatever you need that, you now need to pay for that out of your pocket. Now you're wanting. Well, can I get a Part D plan? Well, yes, you can. Yes, you can. It's not going to pay for anything that happened to you before, but now you're going to pay not only the plan, but you're going to pay the penalty for the plan, and you're going to pay that penalty for life. All
But you can
right.
only get it during certain times of the year. You
Or in
just can't
certain times
say,
of year. We
I
told
want it.
you. We told you already. There's so many rules, okay? It has to be when Sunday falls on a Monday, and you have to be able to jump over the moon
Yep.
with the
Why
cow.
do I try to figure out what at 65 and 70 years old, there's all these rules that older people have to understand and learn. At that age, it's like, why do we have to go through all this, and you think about that, it's like it should be very easy. It really, really should be easier than what it is. And you feel for the seniors. When I talk to seniors and they're like, uh nobody told me this. Well,
Mhm.
because the government, there was so much abuse, the government kind of pulled us in. You can't talk
Mhm.
about it unless you're asked about it. You can't do this unless they sign this. So our hands are tied just a little bit. And that's why we go. That's why you see all these seminars, the Medicare 101s, because these people are teaching you about Medicare. Now there's something called Social Security. What do you call these webinars? Because there's so many facets of Social Security. When do you take Social Security? Do you take it when you're 62? Do you take it when you're 65? Do you take it when you're 66 and 10 months? There's so many things. And if everybody could just go and get what we call a Social Security online account, it's ssa.gov. Everyone needs to know what their Social Security account tells the government about you, because it's all your history of work. All your work history since you were 21 or 17 or whatever is there. Everything that you made is in this socialsecurity.gov account. It tells you if you are disabled, how much you could get per month. It tells you what your Medicare premiums are going to be. If you are a high income earner, your Medicare Part B premium is not going to be 174.70. It's going to probably be more than that. It tells
They're
you all that.
introduced to Irma.
Yeah, and you need this in order to apply for Medicare Part A and B. These are things I have to walk people through it, and they don't take you over the phone. They don't do it over the phone. Then you have to schedule an appointment. Then they tell you to go online. The people don't have a SSA.gov account because they never thought they needed it, but you need to do that. If that's one thing you take away today, is do an ssa.gov account, register, get your information, know how much they're reporting your income to be, know how much you're going to get if you decide to take Social Security at 62, or if you take it at 65, how much you're going to get. It tells you in this account. It's all
That's
there for
right.
you to know. And most people don't know what it is.
Because they don't even know that it exists. But you
Mm-hmm.
know what? I thought about it as we're talking right now. One of our shows should really be just about all these things. Like you want to know about Medicare? Yes, we can tell you, but we can't tell you before you ask us and you sign a permission slip for us to tell you. You want to know about you do have to join at age 65, but there are certain times only when you can join, which is not going to get a penalty. Hey, it's two parts, part A and part B. But don't forget that there's also part C, D, E, F, G, and H. and and I'm telling you, it's just so many different things. You have to sign up at 65, but if you're working, you may not have to sign up unless your employer is got less than 25 people or 20 people or whatever.
20.
Then you
It's
do
20.
have to sign up, and
Yeah.
20 people, right? Then you
20.
do have to sign up, and then you don't have, you could just have your part A, B, and D, but make sure you do not get sick between now and when you die, because you're going to need some kind of drugs, and if you do come back for it, you're going to have penalties. So all these different things, I say we need to do a show on that, because it's truly comical at times.
It is. And it's really it's heartbreaking when we talk to someone and they're just like, I don't want to do this. I can't
Yeah.
do this. And we have to take them by the hand, not literally sometimes. I used to go home to home, but not anymore. I do it from my comfort of my office. But I literally have to calm them down, bring them off the ledge a little bit, and maybe talk to them another time so that it can sink in, because it is traumatic. It's like a traumatic experience and you didn't know about, you know? So that's
Yes,
what we do.
definitely. And so we just kind of give you an overview of Medicare today in Part A, Part B, Part C, and Part D. And we're going to come back and talk about the options that you have available to you, and what does Part C actually mean, or what does Part C or MAPD actually means. We're going to talk a little bit more about that in a future show, and we'll talk about some of the benefits that might be out there that's available to you that you don't even know that is available to you. And we're going to talk about let's see, I had some notes here, some other things that we'll think, but just kind of understanding. Earlier today you heard Aaliyah talk about the fact that she was doing an appeal, but so we'll talk about navigating insurance claims and appeals, and understanding that the first no doesn't always mean no. You have to know how to advocate for yourself. And so there's a lot of other things that we're going to continue to share, whether it's here on Millionaire Ladies Mom, or whether it's on the Healthcare Queen Speaks show, which normally are on Fridays, or whether it's on the Big Facts Money show, which is on Wednesdays. We will continue to come by and bring you information, because we know that if it doesn't apply to you, we know that you know someone that it does apply to,
Absolutely.
and we want you to have those people to reach out to us, so that we can provide them with the information that they need to make good decisions,
Right,
and
right.
save those dollars, and put those dollars into something else.
Hmm.
But for right now, I am Carmen Bernard. You can reach me at carmen10k.com, or you can find me here on Facebook, YouTube, LinkedIn, and TikTok. Oh, and Clapper. I don't know if you guys heard, but
I heard a clapper.
we're in a big mess right now with TikTok being up in the air. I don't think it's going to go anywhere. Something is going to happen to make it stay. But for right now, if you not sure, that's just what I think. But if you're not sure, you may want to build an audience, a team, a tribe on Clapper, since that's American owned, and they're not going to be able to shut that down. But
Mhm.
so you can also find me there. Instagram, Threads, all those places. So come follow me. And Aaliyah, tell them where they can find you.
Okay, so I'm Aaliyah Sherrod, the healthcare queen. You can find me on Facebook, Instagram, Twitter. I think I have Clapper. I'm on LinkedIn also, and I have a YouTube channel that I need to make sure is okay. But you guys need to subscribe to our Millionaire Ladies Mob channel and get our videos. And then next week, Carmen, next Friday, we're doing the series on home health care, and so next Friday I'm going to have two young ladies that own their own healthcare, home healthcare agencies, one on the East Coast and one on the West Coast. And they're going to talk about some of the things that go on in home healthcare that we really need to understand for our loved ones' benefit. So I'm excited about that because these are things that I've been touched by home healthcare. And people need to know what goes on. So again, Aaliyah Sherrod, the healthcare queen. Follow me on Facebook. I'm everywhere. I try to make sure that I go live so people can know who I am and just understand that my passion is helping people, especially those that need it. Our community, again, they're only getting 1.4% of the budget for one state that in their marketing, and we are underutilizing our healthcare. I want you to go out. If you don't do anything, go out, take your annual physical, make sure that you get your results, understand your results, and take action. That's one thing that we can do to help ourselves. Okay. Read your medical records. I have another story about that. That's for another time. Read your medical records. Know what your doctor's putting in your notes. So that's another episode because there's some things that happen and things that can be prevented if you just know what's in your medical records and talk to your doctor because they overlook a lot of things. And then it ends up being your fault. You're
Yeah.
taking, you have the major illness. They don't. Okay. So
Right.
again, Aaliyah Sherrod, the healthcare queen. Thank you guys so much for joining us. Don't forget to subscribe to Millionaire Ladies Mob, like our videos, share them with all your friends and family.
That's right. I might go ahead and join you on that healthcare forum that you're going to have, and then I can bring the lady from the south since we have the east, the west, and the
West,
south, the east
we
coast,
just
west
maybe
coast,
need somebody in
and
the north, huh?
and somebody in the south. And yeah, I don't know if you are have a healthcare agency and you're located up north, New York, Philadelphia, Connecticut, anywhere up the New Hampshire, all those places, reach out to us if you'd like to be a part of that panel as we talk about the state of healthcare for seniors. This is actually a good thing for you because we come across seniors all of the time in different states and we need to refer them to somebody. Could that be you? This is Carmen, and we will see you in 2 weeks. But join us next Friday
Yep.
and next Wednesday. We will be there. All right.
All right.
Be prepared to be sick of me. I'm about to flood your timelines with my mommy's birthday because she is turning 87 on Saturday, and
Oh,
I'm
wow.
going to be sharing about her. So, with that, I'm going to say good night and
Good
have
night.
a wonderful evening.
All right.
Bye.